Okay, so let's talk about, let me share with you the introduction. So this is the introduction of my course and MRCOG Part 3 exam. This is my little bit of introduction that I used to conduct MRCOG Part 3 courses. Like I have been conducting for six years, but last year I gave a gap. So for almost 6-7 months or 8 months, I was not doing Part 3 courses, but I was doing MRCPI OSCE courses. So because I was busy in one of my my degree in ultrasound. So I finished like 2 years of training, and I'm now RDMS. I'm working as an RDMS instructor in US. So I have
Wow.
MRCOG. Yeah, I was very busy.
MashaAllah.
Alhamdulillah. So
Good, MashaAllah. Very good.
yeah, I had MRCOG and MRCPI and Obs and Gynae. And then I have been working as a consultant gynecologist in Pakistan for some time, and IVF specialist, because my I went to Germany for my IVF diploma, and then I came back to Pakistan and then I started working as an IVF specialist for 2.5 years almost. And then I came here to US, and then I started doing ultrasound RDMS course, and then I finished in 2 years, and now I'm instructor of RDMS. So this is what
MashaAllah.
I'm doing.
Really, really, MashaAllah. God bless you. MashaAllah.
Yeah. Thank you very much.
Very good.
But in
Very good.
order to survive, I think, because I'm shifting from one country to another country. So wherever I go, I have to do something.
MashaAllah. Wallahi. Very good. Very good. Really.
So
Something very good.
I'm just telling you guys, for your inspiration, so that you
Mm.
get motivation, that even if you are in Arab country. While I was in Saudi Arabia, I stayed there for 18 years, 18 to 19 years. And out of this, I was working for 18 years. And during this time, I went for, first of all, to Ireland, to Dublin for DOH diploma in women's health.
MashaAllah.
And then I cleared Part 1 Arab board. Then I said, no, I'll go for MRCOG, the European exam. After this,
Mm.
I went for MRCPI. I passed MRCPI. Then I went for MRCOG. I passed MRCOG. Then I went to Germany, and I have done this IVF diploma. So all of this thing while I was working in a country uh, where you cannot do all these courses. But there is one
Yes.
thing, that you have
Yes.
the money. So so you
Yes.
spend money and you go anywhere to do all these courses. And you can enter
Yes.
it.
But it's very good way.
Yeah, so
MashaAllah.
that
Really.
motivation, wherever you are working, you can do it. So it
Inshallah.
depends upon your motivation and how much ambitious you are. So this is our course. We are going to do it in 2 months. We will have exactly like around 10 weeks together with the mock.
Mm.
So we'll finish it in 10 weeks. So for every module, I'll give you 1 week, because
Okay.
you want to go with me, right?
Yes. Yes.
So once we will start one topic, and then you go and finish that module in that week, in whole week.
Yes.
Then we'll start another module, and I will combine, like, because there are 14 modules, but there are few modules that I will combine because they are very short. So we will finish
Mm.
in 10 weeks.
Okay.
So this will be our schedule. We'll start with teaching and surgical module I want to combine. And
Okay.
then we have antenatal, and then maternal medicine, then
Mm.
intrapartum and postpartum, because we can combine these two. Then we have general gynae,
Okay.
then we have subfertility, my favorite topic. Then we have early pregnancy care,
Mm.
we have urogynae, we have gynae oncology. So, uh, like there are few things also, like emergencies. Uh, so how many topics? Until here, it's 9. So one more, I will add here one more for a few things like emergencies and statistics or emergencies or clinical governance and risk management. These things, because sometimes they come to, and labor ward prioritization, gynae list prioritization, these things. I'll add one more, so it will be 10. So our 11th session will be mock exam. I just
Okay.
3 times mock. I don't know why, because maybe I was doing for a lot of students before, but you will have one mock of 14 stations in a go. So we will do same like exam. We will simulate the
Mm,
exam, and we'll
mm,
one by one, 2 minutes. You need to make your bullet points, and then 10 minutes you will do your scenario with me, and there will be lay examiner station, there will be examiner station, there will be simulated patients station. So every module, one scenario for every module, so it will be 14 stations.
okay.
You know what happened, why it is mock is important? I didn't do this mock. So when I didn't pass first time when I went for part 3 MRCOG, because there were no such online courses. And I think these online courses really help, because when you go to UK and you will do Forest, or you go to Birmingham Hospital, you will do 1 day or 2 day or maximum 3 day course. It's not enough. It is really not enough. Although I went for this RCOG, what do you call it? The course that they do before the exam, I forget the name, the RCOG course, 1 day.
Mm,
But also it didn't help me, because the topics that came in the exam was completely different uh, from that course, from that RCOG
mm,
course. So I mean, it didn't
mm,
help me. But here
mm.
we are giving more time, and we are with you 24/7, because I'm with
Yes.
you through WhatsApp, through Telegram. I'll be with you. And anything
Mm,
you have, any problem, you can anytime ask me. So I think this thing helps more. So, and mock exam also helps a lot. I'm doing a separate mock exam for the people who don't want to go through, or they have done courses with other people and they just want mock
mm,
exam. I'm doing it also. So mock is
mm,
important, I think, just to have the feeling uh, of exam, because I was
mm.
really stressed and I was really tired while I was first time I went to UK and I gave the exam. I was really tired, and I was
Yes.
thinking that it's a never-ending story. It's not finishing. I just wanted to finish. I didn't have that
Mm.
stamina. So, so this mock exam prepares you for and give you stamina um,
Yes.
for the real exam. So that's why
Mm.
it's called mock. It's a
Yes, yes.
simulation of the real exam, the same feeling, yeah. So the same,
It helped me a lot on the RCBI. It's a lot. It's make
yeah,
different.
RCPI was, believe me, I passed in first attempt and I did not attend any course. It was
Oh.
not that difficult. But here I attended 3 courses in UK and I failed from the first time. I'm not discouraging you, but I'm telling you that
Mm,
then, and I don't regret that I failed, because I learned from my failure what I did. Maybe if I pass from the first attempt, I will not put another effort for another 2 or 3 months before I go to Abu Dhabi
mm,
for my exam, and I
mm,
gave there. The examiners there, the role player there were completely different and very relaxed in a royal environment. And in UK, oh my God, it was, they were, I this is my experience. Everyone has different experience and maybe things have changed now, but I found that
mm,
the examiners were more tense over there. But in Abu Dhabi, they were
Yeah.
very relaxed, and even role players and examiners all were relaxed. They asked me the same question because they have the same format, right?
Mm.
They have their own standard, but the way they ask questions was different. Yeah.
Yes. Yes.
So
Yes.
where
I
are
think
you going? You are in Abu Dhabi, so you are going in Abu Dhabi exam, right?
yes. Yes. Yeah. I will prefer Abu Center. Yes.
Yes, of
Inshallah.
course. That will be good for you. So
Yes.
we are
Inshallah.
going to do each session, like it can be 3 hours or 4 hours, depending on if we are combining two modules or if we are doing only one module. And then, and also it depends how many people we have. Like nowadays, I am doing one-to-one. So if I'm doing only one person at a time, then it might finish instead of 4 hours, it might finish in 2.5 or 3 hours also. So it all
Okay.
depends how many people we have. So
Okay.
I'll provide the pre-course material. I will tell you what to read before we start any module, and we'll
Mm.
go module wise. We'll try to finish almost all last 5 years recalls and the important topics that usually comes in exam because there are few favorite topics um, that they repeat, you know.
Mm.
So we will go through all these favorite topics that they repeat,
Okay.
and then we'll go through. So even if you went through all the recalls and important topics, you might encounter a difficult station or a strange station which you never did before. So it might
Mm.
happen. So you should know how to deal with this, and you can pass in this station, even if it is strange and you heard it for the first time. So you can pass this station. It's just about a technique, you know. Uh,
Okay.
the trick of passing the stations. Okay, and you can pass in first attempt. After I passed in second attempt, I came to know that what was the reason that I did not pass in first attempt. It's not that
Mm.
difficult, you know, to pass in first attempt. But anyway, now I know, so I can tell you. So you can have access to my part two lectures. So I was teaching part two since I became busy. I stopped teaching part two MRCOG students. I was doing recalls with them, and I was giving lectures. I was making my own notes. Um,
Mm.
and I combine like 3, 4 sources together to create a note, and then I will discuss and I will ask my students. So if you want, if you have difficulty in understanding any topic, then I can provide you with these lectures also. So until,
Thank you.
yes, you are welcome. Until you pass your exam, then you can attend. Unfortunately, if you don't get it from the first attempt, this is not the end of life. It is not. It will not be written in your certificate that you have not passed from the first attempt. So it's okay.
I have, sorry for disturbing. I
Mhm.
didn't pass part two from first attempt. I passed from
Yeah,
the third attempt.
yeah, no one passed.
And it made for me like disappointed and I feel depressed, unlike this one. It
Yeah,
made,
it's normal feeling. So
yeah,
if
the,
you feel
yes,
depressed, then you will but not depressed to an extent that you don't want to do it again. I mean,
no, I want to do it and I want to finish it. Why I didn't
yeah.
pass? Every time I said,
So
and
it
I,
could be like this, yes. Why I didn't pass?
yes, why I didn't pass? And
Be
just like
upset.
1 mark, every time 1 mark, 1 mark.
Yes.
Yeah, and it's very bad, wallahi,
So it
feeling.
was your motivation actually until you do. No one passed part two in first attempt. I have seen one lady. She passed in one of my students. She passed in one attempt, one or two only. I don't see a lot. So, but they didn't pass part three in first attempt. So once you
Mm.
are very good in your knowledge, because sometimes you can pass by chance because whatever you read, it came in the exam. It
Mm.
might happen, you know, but because
Mm.
you don't have complete knowledge, So you cannot pass part 3 in first or second attempt. So I think it's okay to work hard in your part 2 so that you can pass part 3 in first or at least second attempt. So there you are not losing anything actually. So
Okay.
so in unfortunate, if in case, God forbidden, if you are not able to pass from the first time, you can attend my future courses as listener. And if you want, my old students will have special discount for an active participation. And then, of course, I'm with you all the time until you pass your exam. So you need to find your study partner. I
Oh,
believe that this is very important. So I don't know if
oh,
you have your study partner or not, because the stations that we discuss with each other are not enough, I think. So you need to do it with your study partner. Now, my time I was having a study partner, but not all the time. So I my daughter, who was 14 years old, I used to make
mm,
her my examiner, and the role player. So some
oh,
people like to do it. So she knows all the gynae problems and everything from 14 years old, even younger. So, and sometimes uh, I heard some people, they are standing in front of the mirror and they speak, and they
mm,
record their own station, like they become examiner by themselves or role player by themselves, and then they record themselves. So whatever, but you have to do something. If you don't have a steady partner, you need to find an alternative, because the stations, you need to do more stations than we are doing it here. And then, of course, I can't
mm.
emphasize it more, that you have to revise your guidelines, all kind of guidelines, green talk, nice. Uh, you have to look at your consent, clinical governance guidelines, and patient information leaflets also, and your important talk articles. Now,
Okay. Okay.
you have your OSCE books. The one
Mm,
I recommend, there are a lot of OSCE books in market, but
mm.
it's mm, it is not. So I want you to, I don't want you to go through all the OSCE books. So I
Okay.
want you to concentrate on 2 or 3 OSCE books only, and get hold of it, of these 3 books. Like, for example, Get Through, Tony Hollingworth and Lisa Joy. So if you are doing these 3 and you do it like 2 or 3 times, like you do it in detail, and you really understand what they are teaching you, and you go through their stations, you do it with your study partner, these 3 books are more than enough. You don't need more fancy names and other books. This is more than enough.
Okay.
I will send you the PDF of all of these books, the new edition. And then, yes.
Okay.
So we'll do a mock exam, as I told you, which
Mm,
will make the real exam. I want to give you one saying, uh, which is a motivational saying. When you want to succeed as bad as you want to breathe, then you will be successful. Because what we were doing when we were preparing for exam, we were not going for our vacation. We postponed our vacation, and we took our vacation, and we were sitting at home to study.
yes,
And
sir. Yes.
what we were doing, that we have kids, but I was like uh not cooking every day, So you have to lose something in order to gain something. So you are not super uh, man or superwoman. So what I was doing, I was not socializing. My relatives was always complaining that we don't hear from you and you are not calling us, and I didn't know what is going on in my family. And this is not a good thing. I'm not saying that you should always do it, but while you are preparing for your exam, you have to give all these sacrifices. And
Mm.
I don't go out to different countries. People are going uh, on for their vacation to spend their vacation. I didn't go for many years until I finish all the exams. But yes, this is what um, you have to give something in order to gain something.
Yes, right.
So I want to do with you two stations actually, you know, so that first of all I will know about your background knowledge, and then you should have an idea that how the questions in RCOG are different from. I know that you have passed your MRCPI with me, and then
Yeah, that's why I said to you again.
yes. So and now you are in part three with me. So what is the difference?
Mm.
There are 14 stations in MRCOG part three. Okay, and there are simulated patient, which is a role player, and there are examiners also. In RCPI, most of the scenarios are um, they are what you call it, the examiner. The examiners are the one who are examiner scenarios. So you have in front of you your examiner. But
Mm.
here in MRCOG, you can have simulated patient and almost equal, or sometimes more examiner and sometimes more simulated patient, but you can say 50%, 50-50. And
Mm.
you have some, because there are 14 stations, you have sometimes lay examiner also in 3 or 4 of the stations. You might see them. So this happens in communication stations. So when you are with your role player, they will be sitting there quietly, and they will judge how you are talking from the patient point of view, and do you understand, and are you empathic, are you are explaining well, how is your communication. So they will give marks on all of these things, these lay examiners. So of course you don't need to communicate with them. You will communicate with your role player, with your patient, and you will communicate with your examiner in examiner-led stations. So
Okay.
in MRCOG, you have domains.
Mm.
Although in RCPI, you have domains too, and you have to go stepwise, and there is a format, and you need to be organized. But it is not written that what domains you have. You have all these domains. You should go through all these domains, but it is not clearly written, you know. But here, everything is more organized. So it is clearly written that you have these 4 domains in order to
Right.
pass the exam. So first of all will be information gathering. In information gathering, it's not only history. So her history, her result of examination, result of investigations, and and the whole history. So and handheld notes if she has, or discharge summary. So everything will be included in information gathering. So from you, or maybe asking from the midwife if you are in the labor ward, will be part of information gathering also. And
Mm. Okay.
communication skills, um communication with the patient, with the relatives, and with your colleagues, like your consultant, your senior, your colleague, um, and your juniors. So this is communication skill. And then applied knowledge will be whatever we read, whatever knowledge we have from our part two, we need to apply in part three. And actually in real life, we need to apply that knowledge, whatever the knowledge from the guidelines and from the talk articles, or from wherever you are reading, we need to apply it, right? So this is applied knowledge, and you are applying it uh, in the form of these stations, and in your offices and your clinics, when you see a patient, you are applying your knowledge, right? So,
Yes.
and then patient safety is very important here in RCOG exams because every station has almost every station has a patient safety domain. So if you don't talk about it, it's very difficult to pass that station. So yes,
Mm.
every domain you need to pass, and there's a passing mark, which is every time it's a little bit different, 65%, 67%, 68%, something like this. But according to the, the candidates that you are competing with, so it can change. But your target should be like more than 70%. It should be more than, and your target that you should be more than 70% or 75%, then only you can pass. So you need to set your target higher, so if you
Okay.
pass. Yes, so patient safety is important, so do not like forget this part. So this is the station. It's a so you have like 12 minutes for each station. Unlike RCPI you have 10 minutes
Mm.
together. So you enter, you read the station in front of the examiner or in front of the role player, and then you start talking. Everything in 10 minutes. But here you have 2 minutes to read the station, to read your text, to read the station, your scenario, sorry. And then you make bullet points in your mind or in the notebook that will be provided to you. And then when you go inside, you start your station immediately by greeting the examiner or the role player. So I want to say that you have 12 minutes. So these 2 minutes extra that you have is a luxury, which you
Mm.
don't have in RCPI. So, so the people who pass that exam, they know how to go very fast. But because they have 7 stations and here there are 14 stations, uh, that is different. And the time is more here also because instead of 10 minutes, it is 12 minutes. So
Mm.
I want you to use this 2 minutes wisely and write the bullet points only. There is my what you call it, information, and in one of the video I only talk about how to write your bullet points wisely before you enter and encounter your examiner or your role player. So we will be talking about bullet points, that how should you write and what should you write. Let's go one by one. Like this is a simulated uh, patient station, and these are the domains that you will be awarded marks according to these domains. And then so I want you to read this station. I will give you 2 minutes. I will put my timer for 2 minutes. Then I will see how you write your bullet points, what you are going to say in next 10 minutes in the form of bullet points, and I will correct you. Then we will move to the next, which is you start station with me 10 minutes, then I will show you the model answer, what you are supposed to say and what you said. So let's start because I know you have your background knowledge of MRCPI, OSCE. So let me start 2 minutes. Now you can start reading and make your points. You can write it in your notebook. Your 2 minutes starting now.
That's good. That's connecting the room and world bank communication system in also yeah.
Okay. So 2 minutes finish. Shall we do 10 minutes of station and then I will correct you? What do you think?
Yes, yes.
So we can start.
Hmm.
Just start, how to greet, how to enter, how to talk to a role player. We did it. Okay, start.
Hello, I'm Dr. Haifa, one candidate. I'm ready for exam.
Oh, 1 second. In this way, you are talking to the examiner, but this is a patient in front of you, a simulated patient. So,
Ah,
you need to greet her first, and then tell your name and your position that I'm one of the candidate, and
yes.
then after you tell your introduction, your full name, and tell what is your position, like you are one of the candidate, and I want to ask you, may I ask you your full name, please, and your age? Can I confirm
Sorry.
your age, please? So like this, So let us start.
Okay. Hello, I'm Dr. Haifa, one doctor in duty today. How are you?
I'm good, doctor.
Yes, my name. May I know your name and age, please?
Yes, I'm Elizabeth Murray, and my age is 20.
Ah, nice to meet you, Elizabeth. Elizabeth, can I ask you why you are here today?
Yes, actually, doctor, I came to know that ultrasound is done, and they told me that your baby feet are like club feet. They are inverted inside, and I cannot carry a disabled baby because I'm a student and I'm also working part-time, and I cannot deal with it. So I want to do termination of pregnancy.
Sorry to all hear this information. I'm here to help you, but can you tell me what is your expectations from this visit, and what is your concern also?
Yeah, my concern is the same, that I don't want to continue the pregnancy and I want termination of pregnancy. Um, for the reason I told you that I cannot.
Mm, okay. Before we proceed for this termination of pregnancy, can you tell me more about your pregnancy? It is spontaneous pregnancy?
Um, yes, but it is not a planned pregnancy. So I came to know that I'm pregnant, although we were using condoms, and my partner also was not expecting. But then I became pregnant, and I didn't even know. After some time, I came to know, um, and I accepted it, you know. So, but later on, when I came to know about this problem, then I said, no, I cannot.
Oh, okay. When you know you are pregnant, how many weeks?
Yeah, I think after 6 weeks, I just did the pregnancy test when they told me you are already 6 weeks.
Okay, and you take folic acid this 5
After
pregnancy?
6 weeks, I started, but not before.
Okay, and you do this the first scan, first ultrasound for the baby to measure the fluid behind the back of the baby.
Yeah,
You
actually,
did this.
I have done the first scan in the first 3 months, and now this is my second scan.
Okay, the first scan was normal.
Yes, actually, they didn't say anything. It means it was normal. Yes.
Okay. Do you have any medical disease? You have high blood pressure, high sugar?
No, I don't have any problem.
Okay. Do you have any family history of cancer?
My
No.
mother was is hypertensive, and my father is diabetic actually, and he's on medication. Both of them are on medications. They are doing well on medications.
Okay. Do you have any surgery in your tummy or down below?
No.
Okay. Do you receive any medications?
Uh, no, I was just taking my
Dra-
vitamins. Yeah, nothing is special.
Do you have any allergy for any medications?
No.
No. Um, do you smoke?
Yes. Um, and it is like 3 or 4 cigarettes per day, not too much. Mm.
Okay. You know, smoking is not good for your health. We can provide you for the clinic to help you to stop this smoking.
Yes.
Do you take? Did you alcohol or taking recreational drugs?
No recreation drugs, but alcohol, yes. Sometimes I drink on weekends.
Okay. We need to we'll advise you also to decrease this alcohol. Okay. Because it will affect your health, your general health. Okay. Any information you want ask me, you want to tell me about?
No, that's it actually. So, doctor, what about if I don't want to continue?
Okay, don't worry, we'll discuss this point, Elizabeth. But sorry to ask you this question.
Mhm.
Do you have any sharing disease, sexual sharing disease?
Uh,
No.
yeah, once I had chlamydia infection, once, yes, but I was treated.
Okay. Okay. You know your weight and height ratio?
Yes, it is 25.
Okay. Thank you, Elizabeth, for sharing this information with me. We'll examine you in presence of chaperones and we'll provide you with some blood to do it. Okay, we need to do your blood, your hemoglobin. Okay, and also we need to know your blood group. Okay, and then we'll make appointment with our consultant. Okay, and baby doctors also, namely neonatology. Okay, group of doctor will come and discuss with you how the baby looks and how we can do this termination of pregnancy. But before that, we need to go to revise your report for this ultrasound you did last time.
Mm.
Okay, just to check the water around the baby and where is the afterbirth there. Okay, and then we'll come and discuss with you the termination of pregnancy. I'm clear so far?
Yes, doctor. Also, I want to know why it
Yes.
happened with my baby.
Okay, this telebus have there is multiple causes. A lot of causes can do it. It may be because of position of the baby in your in your womb, or around water around the baby is less, or sometimes because the size of the uterus is small, your womb is small, or sometimes it's something just genetic. Other causes like smoking also can cause this curve of the baby foot, and also maybe infection. Okay, we can give you This is out of the course, okay?
Mhm.
And before we proceed for this termination of pregnancy, okay, we need to give you consent that you can know the detail of the operation itself and how we'll do, okay? And we can do with several ways. The option of the termination, we can use medical medicine. We can give you some medicine. First, some medicine to open the womb, the neck of your womb, and then another type of medicine to help to expulsion of the baby. Okay, it will be in the hospital, and we'll take care of you one by one. And you will go through mini labor. Okay, and this medicine it can cause for you some nausea, some abdominal pain. Okay, we'll provide you some painkiller, analgesia to decrease this pain. Then you will go through as I told you, it's like mini labor. Okay, then you will you'll bear your baby. Okay, I'm clear so far, Elizabeth.
Doctor, am I too far? Can I get a termination at 20 weeks?
For social causes, we can give termination up to 24 weeks.
So I have only
After that,
4
I
weeks
think we cannot do this one.
Okay.
Yes, but yeah, we'll confirm this information with our consultant, and we'll make our consultant to meet you and give you further information about this one, about
Can,
the
can
the,
my baby
the
come
date
like,
and the details of the. Uh,
okay. So doctor,
sorry,
is it
Dr. Smith.
possible that my baby come alive at 20 weeks? Or because we are not doing it now after 1 or 2 weeks, so there is a possibility.
Yes, if we did it late, for example, between 22, 23 weeks, we'll give your baby some medicine, potassium chloride, its name. It's just to stop the heart of the baby. So the baby will not the baby will not suffer, and you will not feel also, the baby will no need for resuscitation or helping. Okay, if we deliver between 22, 23 weeks.
Okay.
Okay.
So okay, now we are done, and yes, just start. Tell me what you have written. Start from the beginning, then I will show you the model answer. What you have written in your bullet points in the 2 minutes that you had.
Uh, I write history, examination, investigation, CBC, blood grouping, and I write also MDT, consultant neonatology, and patient information leaflet. And I write termination of pregnancy, consent, options, pros and cons, and post-abortion
Mhm.
psychological support.
Okay. So you have to say at the end that I'm going to provide you with the patient information leaflets, support groups, and you can follow up with us, and you can come back and discuss with the consultant also,
Yeah.
you know.
Mm,
So the follow-up appointment. And
yes.
you said that you will refer to the neonatologist, right? So, which is good. Now, you said only one thing in bullet point. You wrote CBC and blood group. So when we are doing routinely the CBC and blood group
It should be at booking.
at booking,
So I need to say,
maybe you already have done it. And the second time we are doing it at 28 weeks, I believe, unless there is some twins or something or some other abnormality, so some other medical disorders. Otherwise we are doing it at booking 11 or 12 weeks or 10 weeks whenever she's booking, and the next one is at 28 weeks. So just remove this CBC and blood group from your bullet points.
okay.
Okay, so that's fine, that's not bad actually. Let's talk about what you said. First, I want to show you my model answer so that you know what you have said. So what are the issues in this scenario? This girl, first of all, she's 20 years old.
Mm.
Second, she had bilateral fetal talus. Sometimes the fetal talus is only in one foot, but she has bilateral, both feet. And third, she wants termination of pregnancy, which she needs to be counseled. Yes, which you did. So these are the issues with that girl. Don't forget that she's 20 years old. So when you started, you took her in confidence that this is, you ask actually, after you introduce yourself, your full name, and then you confirm her name and her age, and you even ask her her agenda, what are you expecting from this consultation, what is in your mind. So you are asking about her background, her agenda, and not only this, uh, i want I wanted you to ask her her background knowledge of this fetal talus, what she knows about it, then you can tell her. So then you ask her agenda, which is fine. And if she has any concern, you ask also, which is good, because we need to know why she is here. What
Mm.
she just want to know the information, and she want to continue the pregnancy, or she is here for termination of pregnancy. And if she will not tell you why she want termination, like she told you why she want, but if she will not tell you, then you have to ask her why she want termination of pregnancy. What is her knowledge about fetal talus, what she knows or what she heard.
Mm.
Then you took the
Mm.
target history, like whenever the patient is pregnant, you have to ask her, especially currently in current pregnancy, how she is doing, like what is her fetal move, if she felt her fetal movement of the baby or not, if she has any abdominal pain, any bleeding or leaking from down, and then start from the beginning of the pregnancy. Like she told you that it was not planned, but if she will not tell you, you have to ask her, was it a planned or unplanned pregnancy? Why you are asking? Because if she used folic acid, like this girl, she didn't use until 6 weeks because she didn't even know that she was pregnant. So,
Mm.
and then if she has done her serum down screening, and the result, what is the result of her blood and urine workup, if everything is fine, and the anti-scan you ask also, then you ask about the detailed scan, and because you don't have the result of that detailed scan, you can say that I will review uh, uh, your scan also, and maybe we'll need to send you for another detailed scan. So if she's falling, if she's compliant, she's 20 years old. So if she is uh, compliant with her appointments or not, how many times she has seen a midwife or a doctor. Then her health, like her medical history, medications and allergies, which you have asked, family history, you have asked, social history, you ask about smoking, alcohol, drugs for fun, and support at home, if her partner is supportive. And if she is, because she's 20 years old, that's why you need to ask that if she is a student and if she is working or not, and who is supporting her, and with whom she is living.
Mm.
So she is
Yes.
primary gravida and it is written, so there is no need to ask any obstetric history. So after taking history, you need to counsel her regarding your knowledge of TELEPS. You need to ask her first, what is her knowledge of TELEPS? Then you will tell her what you know. So you can say that because she asked you why it happened to my baby. So you can say that it can happen in 1 in 1,000 babies, and it might be due to the shape of your uterus, maybe due to the position of the baby, or due to less water around your baby. So, or maybe it might affect only one or both feet, and it can be unknown cause, like idiopathic. Most of the cases are idiopathic, so
Mm.
it can be unknown also. So like you are telling the examiner that you know about the causes of fetal TLFs. Then you can say that, okay, there might be genetic factors also, like there is still a chance 3 to 4 in 100 that it might recur again. So, and you need another scan, a detailed scan because it can be associated with other structural defects like your spine problem or a joint problem. So I'm going to refer you to a special doctor or a fetal-maternal specialist. They are going to do a detailed scan for you and will tell you clearly about your options, you know? So
Okay.
yeah, they will scan her in detail. She might need a needle test, you know? So tell
Mm,
her that needle test can be done to rule out the chromosomal problems to make sure that there is no other chromosomal problems with this baby. And if it is isolated, like only the TLFs, then you can counsel her, Then you can say that then after that, we will know that if this is the only problem, there is no other genetic or chromosomal problems associated with it, and there is no other structures that is deformed also, and we are sure about it, then we can talk about termination of pregnancy. If she will
okay.
say, no, I want it in any case. Uh, so you are not going to say, no, think about it. This is her right. So you can say that, okay, even if she's not asking because she came here for this, so you have to give her options that after this, even if it is isolated, we will you can do it until, as you said, 24 weeks, and after 22 weeks we need to give you an injection to the baby's heart so that the baby will not deliver alive, as it will be difficult for you. So if she decides to continue the pregnancy and it is an isolated defect, then tell her that it might be mild and might not require any surgery. And if surgery is needed, it can be corrected after delivery, so that you need then tell her about the specialist doctors that you need to be with the team of the doctors, like your what you call it now, the doctors that will do your detailed scan and might do a needle test, the doctors who are going to operate the baby, and the bone doctors, they all will talk to you that how how your baby will what will be the prognosis of your baby, and then tell her that you will need follow-up scans too during this pregnancy. So you can
Okay.
say that you can deliver, because at 36 weeks you need to decide how any lady is going to deliver. So she can deliver vaginally. There's no problem. There's no need for cesarean section, and she can deliver at term. Then there's no need to induce her also, but she should be delivering in a obstetric unit because there will be need of treatment after delivery. All doctors should be there to see her, pediatric doctors, and then give her patient information leaflet, support group contacts, and offer next appointment with consultant like you did. There's one more thing which you said good, and which I will add it in my model answer, that you told her that we are going to, if you want termination of pregnancy, you're going to give her some medicines that might cause nausea, vomiting, shivering, and maybe some kind of diarrhea to you. With this medication, you will go into a mini labor, and you will pass either the whole thing and the afterbirth also, but you might need a surgical evacuation for your afterbirth. So just tell her in case that she might need uh, removal of placenta under anesthesia. And then all the things were fine. Whatever you said was correct. So, this is, you give me 1 point, and I gave you a few points also that you can ask. So what do you think as compared to your
Yes.
CPI experience?
That I didn't concentrate in a lot of points, and I forgot the history. This point of the partner, how she do for living.
Hmm.
I forgot this all. And I think also
Because
I
there are points for her young age, the things that you need to ask, and then the knowledge of TELFs.
Mm.
So from where you read about your birth defects?
For the for this syllabus, we have
Birth defect
case.
like spina bifida, diaphragmatic hernia, um, what you call it, omphalocele, gastric case, gastric cases. From where you read it?
From my RCBI, I read from some book one of FMU consultant give me, and also I write NHS health. I write like, for example, Down syndrome NHS, and then I
Mhm.
will see how it looks rating. I didn't have source,
Yeah,
but
there's
this,
a website of, in NHS where they talk about birth defects, and some people read it from the textbook. And like in high risk pregnancy, there's a talk about all birth defects, and you can write NHS and it will come to you. Down syndrome is very nice in detail in NHS, and spina
Mm,
bifida is very nice, and diaphragmatic hernia and omphalocele and these things are also nice there. So you can go through this. Yeah. So you need to have a little bit more knowledge about fetal TELEPs, and
mm,
and if she want to, so you will counsel her about termination. This is why she came, but you have to tell her that first of all that uh, we have to make sure that it is not associated with any other structural problems or chromosomal or genetic problems. And if it is isolated, it means that it might be mild and might be severe. And we will do your scans. Sometimes the fetal position looks like that there is a fetal talus, but in follow-up scans we don't see it if it is mild, so it can go away. So we need to do follow-up scans. And
mm,
even if it baby delivered, and it's not necessary that the baby need a lot of surgeries. Maybe it's just uh, a special boot that the baby will need only. And
mm,
and sometimes even if it needs surgery, uh, mostly it will be corrected. It is not something that can affect that will make the baby disabled, you know, and it is correctable defect. So
mm,
it's not that it is incorrectable, but even if you want termination of pregnancy, then this is the information about that you can do it until 24 weeks. If you reach to 22 weeks, we need to give you the injection to the heart of the baby so that she'll not, the baby will not deliver alive because it will be difficult for you. And then you can say that uh, yes, you will take some medication that can give you these side effects, and you will be in a mini labor. You will be provided with the painkiller injection, because this is very important for a patient. Mm,
mm,
mm, mm, mm, mm, mm. And then you might need an evacuation for your afterbirth, if in case if it will not come together with the baby and you start bleeding, then we will take you uh, to clean to remove the placenta, the afterbirth. So all of these things
mm.
in short period of time.
Then I need to read about this one.
Okay. Now let us do one more. Actually, you did well for the first case. You did actually very well. You know how that you have to ask the agenda of the patient, what is her concern. You ask her, you go stepwise, you ask her about her pregnancy, then you ask like you also talk about the multidisciplinary care. You talked about the patient information leaflets, and then you counsel, and then you talked about the timing of the social abortion, KCL injection. Although I prompted, but then it came out. So when the role player is prompting you for something, you might not get 100% of the marks, the full mark, but you can still get like at least 60-70% or half at least. So, but a lot of prompts maybe they will not like it, but a few prompts is okay.
Okay.
Now this one, I want to give you 2 minutes to write the bullet points, and then we will talk about it.
Okay. Yes, okay. Okay. Just put confirm accounts. I forget this such a thing. I think it's something. HIV, I think history. Yes. No. Let's see. Awesome. Art. Art. Postpartum.
Okay, are you ready?
Yes.
So we will start.
Yeah.
And now you know how you introduce yourself, you ask her name, and you confirm her name, although it is written here, but you need to confirm from her and her age, and then you start. Mm.
Oh.
So start.
Hello, I'm Dr. Haifa Abdullah. I'm one doctor in the clinic today. May I know your name and age, please?
Yes. So, doctor, I'm Darlene Delcy, and I'm 12 weeks pregnant. Mhm. And I'm 30 years old.
Nice. Oh, nice to meet you, darling. I came to know you came today to discuss your lab result. Am I right?
Oh, yes. They have done some blood test for me, and instead of telling me, they send me to you. Is everything okay?
Yes, we'll discuss this result later, but can you tell me what's your expectations and what is your course here?
Actually, this is my first pregnancy, so I'm excited. And I'm 30 years old, so I have been waiting for this pregnancy actually. And now I have,
Okay.
like, at last I have a stable partner, so I decided to become pregnant, and my partner is also very happy with this pregnancy. We both planned it.
Okay, congrats for your pregnancy. Darlene, can I ask you some questions before I give you the details about your lab result, everything?
Oh, yes, you can.
Uh, is this your first pregnancy and planned pregnancy?
This is planned.
And it was a spontaneous pregnancy, Darlene?
Yes, yes.
It's, um, do you have any problem in your pregnancy, like this morning sickness? nausea?
A little bit of nausea, and sometime I throw up also once in the morning or twice sometimes, but otherwise it's fine.
How are you now?
I'm good now. I'm better than before.
Do you take the folic acid this types of pregnancy?
Oh, yes, I took it even before the pregnancy. Like I have been taking it for a few months.
Good. There is no losses from the no vaginal bleeding, no discharge.
No, no, I'm
No.
mhm.
Do you have any do you have any disease
No,
like high diabetes?
I'm healthy actually. I don't have any problem. Mhm.
Okay. Any family history of cancer?
Yes, in from my mother's side, they're having like cancers of the uterus and ovaries, and from my father's side, they are having like health issues like diabetes, heart problems, things like this.
Ah, okay, sorry for that. Do you have any surgery in your tummy or down below?
No,
Any medication rather than this folic acid you take it?
now I am on prenatal vitamins.
Okay. Do you have any allergy for any known medicine?
No, I don't have.
Okay. Darling, sorry to ask you these questions, but it's part of our consultations. Do you have any sex sharing disease?
Uh,
Sexual sharing disease?
yes, I have
Mm-hmm.
twice or three times actually, because I was like with some of the partners who are with some other people, and I got from them. So it is like three times.
You know that what you have, the disease name?
Yeah,
Do you receive?
it was gonorrhea, and one time it was herpes also that I got.
Okay. You receive medication for that one? Drugs?
Yes. Yes, I
Uh,
got treated for it.
okay. And how you feel now?
Yes, I'm good. I'm good. And I don't have it like since I have my this partner, he is stable with me since 1 year. That's why I decided to get pregnant with him.
Okay. Do you smoke?
I used to smoke, but I'm very excited for the baby, so I reduce it to like one cigarette every few days, Not I almost stopped it.
Very good news. Do you take alcohol or recreational drugs?
Yes, I used to take alcohol every day, uh, but now I'm just taking it once in a week or once in 2 weeks and not too much.
Very good. Very good. Uh, Darling, what do you do for your living? To live.
Um, I'm working in one of the private firm as a secretary.
Okay. You live with your partner, yes, you said?
Oh, yes. Mhm.
Yeah. His support, yes?
Yes, he's very supportive. He's a nice one.
Okay. You know your body to height and weight ratio?
Yes. It is
Yeah.
24.
Okay, very good. Do you want to tell me any information?
Oh no, actually, I just want to know why my midwife sent me to you. I mean, is everything okay?
Okay, Darlene, thank you. First, thank you to sharing this information with me. Okay. Uh, the results of your lab result came like you have one of the sexual sharing disease name. It's HIV. Do you know what is HIV? Do you hear about this?
Yes, I know. Is it the one that can become AIDS?
Sorry to tell you this one, but yes, it's HIV. It's same the AIDS. I'm sorry again, but the result came like you have confirmed this HIV. We, I'm sorry, we need to confirm first from your partner, okay, to see if he have this disease also, if have this infection also. Then we need to, I need to, uh, we need to make like joint clinic with group of doctors will take care of you, doctors of the infections and beside of us to take care of your baby, okay? And the do you know the causes of this disease, this infection?
Yes,
You know anything about it?
I know that it is sexually transmitted.
Yes. I'm sorry to ask you this question. Do you have any blood transfusion before?
No.
No. Okay. I'm sorry, Dareen, but the causes of, as you know, the causes of infections may be the HIV, maybe sex, maybe blood transfusions, and sharing needles if we have this using these recreation drugs.
I never.
Okay.
Mhm.
We yes. Okay. Will take care of you, okay, from this HIV. Will arrange with other doctors who will confirm he will confirm if your partner have this disease, and they will recite for you for some medications. It will not harm the baby, and it just will help you to decrease the decrease the severity of the this infection, okay, and also will do for you the regular blood test, okay, and also for to see the viral load of this infection and how it's relation with the medicine, okay, and also will do for you the will take care of your baby. Will do another ultrasound when you are on 20 weeks, okay, and also we do for you the sugar test when you are like 6 weeks, and we tell and we repeat the blood to see if there is any loss of the blood anemia like this, or when you are 7 weeks, 7 months, sorry, 28 weeks. I'm clear so far.
Doctor, you said it's not going to affect my baby. Is that true?
Uh, we'll follow your baby to be sure it's not affect. But if we want to be sure more, if not to not affect the baby, you need to adherent for you the medicine we will give to you, and we'll do for you regular blood test to see the level of the uh, medicine to the viral inside your body, okay, and will advise you also according to the level of the viral load,
Mm.
okay, and if there is no other infection like this virus for the liver, name hepatitis C, like this one, to be sure everything is good, we advise you to deliver by cesarean section, okay, by the operation Caesar name. Okay, and also will advise you to not feed your baby. Okay, and continue your medicine. Okay.
Okay.
Uh, Also will yes, when you came on 9 months and are set 6 weeks, will sit with you. Will tell you better to deliver by this cesarean and better to do it when you are set 9 weeks. We'll do it on the hospital. Will do in hospital with consultant care, okay, and we'll make appointment with anesthesia and will inform the baby doctor to attend the delivery and take care of the baby, and he maybe do some blood tests for the baby also. And after your deliver will advise you to not feed your baby as it will affect. If you do this cesarean operations and you not feed the baby, the risk of the baby to have this infection is less than 1%.
Oh,
Okay,
oh,
and will provide you with psychological support and will give you some patient information leaflet to help you. And there is supported group also we can share with you this one. Okay. And
I want to
after
contact
you
my husband, doctor, so that you can inform him in a better way.
you want to inform your husband by yourself, you mean?
No, I will bring him with me. I'll inform him, but I want to bring him in next appointment.
Yeah, you are welcome. We can arrange this one. Also, we can make appointment with our consultant, so he will give you more information, and he will help you. You and him, you will put plan for your pregnancy, how it looks like, how it's going, and also care during labor and after labor.
Okay. So
Okay.
the only thing which I will say in the beginning, that you took like almost, there were only 3 minutes remaining for the rest of the station, and 7 minutes for history. Information gathering is 7 minutes. So you have to reduce, and how you will reduce your information gathering? By practicing. I know you are out of practice with the stations for a long time, but once
Yeah.
you are doing it with me and with others, then you take only 4 minutes maximum for your
Oh,
information.
yeah. Okay.
So you will do it. It's okay. So you have to know that it is a breaking bad news. She came very happy and excited. So you have to follow the steps of breaking bad news. So, but
Mm,
before breaking bad news, I prefer, because some people are saying just break the bad news first and then take the history. For me, practically, if I'm sitting in a clinic with my patient, I will not do it, because after I will inform her, she will not be in a position to tell me anything. So the same thing I want you to do also in front, because this is your simulated patient. So
mm,
ask her history, targeted history, like she's 12 weeks. So until 12 weeks pregnancy, how was her pregnancy going? Like you asked, nausea, vomiting, pain, bleeding, and if this pregnancy was planned. She said yes, it was planned. She's very excited about it. If she's still on folic acid, so she will tell you, yes, I started folic acid many months back and all of these things. So you ask about health problem, medications, allergies. You ask about her smoking, alcohol, which she's doing well. And this question is very important. So you ask. It is part of the safety that you ask this question. Like she had two types of sexually transmitted infections before, herpes and chlamydia, you know.
mm,
So this question is like important. So you need to ask about her support, her occupation, and how are things at home. If her current partner with her since how long. You need to know if she told you that he's with me, he's stable with me for 1 year. But if she will not tell you, you have to ask that if this is the stable partner. And you should know about any high-risk sexual behavior also, even in past.
mm,
And if she's practicing safe sex, even now with her partner, and then her family history. So you will talk about the blood workup and dating scan. You ask her if she has done it or not, and the dating scan is done or not. And then you ask about the history of blood transfusion. And here you can ask about her blood group also. But yes, history of blood transfusion is very important. So why you're asking about the blood,
mm,
if she's RH negative or not? Otherwise, there's no need. But with pregnant ladies, I think it is better to ask about blood group if you don't know. Like you asked in the last, maybe CBC, not that important, but blood group, yes. In pregnant ladies, ask everyone. And even you can, yeah, she is 12 weeks, so there is no problem. Just blood group is enough. So ask her before you start to break bad news, ask her if there is anyone with her outside, and offer her that she can call someone to be with her, as it is going to be a difficult news for her. So you have to give her the first warning, and tell her then after
mm,
after giving the first warning, tell her that that confirm that we confirm your name, and if this is your NHS number, and after confirming this, which is written on your report, it says that you are suffering from a viral infection called HIV, and I'm sorry to be, like you said, to be the bearer of this news. And then she looked very upset. Then you needed to ask her, do you like to continue the consultation? And she will say, of course, yes, I want to continue. So then start counseling. Then start counseling. Then you can say,
Mm.
uh, like you said, multidisciplinary team, HIV specialists, counselors, and she need to follow up in a consultant-led unit. Then talk about the rest of her pregnancy, the plan of her pregnancy. Always divide in trimesters. Like she finished first, so you can talk about second and third trimester until 36 weeks. Then at 36 weeks, plan of delivery, mode of delivery, place and time of delivery. So this is all plan of delivery, like mode of delivery, place of delivery, time of delivery in every pregnant patient at 36 weeks. And then you talked about some CD4 count also, or you can say that some cells which provide immunity. We have to see if you have enough immunity against it and how much virus in your blood, so viral load, and then talk about starting heart, the medication which are more than one in number, like two or three. It's a triple medication, two or three in number medications, and because you will be on that medication, that's why you will be at risk of getting diabetes during pregnancy, so you need GDM screening. Then you talk about other STI screening also. You have to do for syphilis, for hepatitis B, for hepatitis C, and even chlamydia screening. All screening, STI screening needs to be done. Then and fetal monitoring also. You will monitor the baby by doing like anatomy scan, and tell her that the only thing that can happen that to the baby is that baby might get this infection, and how you can prevent it. First talk about it 36 weeks, then decide about the mode of delivery. Then tell her that, give her some hope also. So if her viral load is less than 50, she can deliver vaginally, otherwise cesarean section with all the precautions. If you have early rupture of membrane at term also, so we will induce you as soon as possible, even if the virus is less than 50, and no breastfeeding. So tell her that, as you said, that all these precautions is going to reduce her risk of transferring infection to the baby from 40 to less than 1 out of 100. Don't say percent, avoid it. You can say 1 out of 100 or 1 in 100. Otherwise, we'll go for cesarean section. Now, encourage her to talk to her husband, because she said that I want to inform my husband, but if she will not say, you have to tell her that talk to your husband and get him tested, like you said, and then use condoms for sex, and talk about contraception after delivery with condoms. So I'll say that even after delivery, you have to use condoms, uh, even if you want to use some other contraception, but use condoms for safe sex. Talk about the need of, you talked about neonatal follow-up and the patient information leaflets, appointment with the consultant and support group, because she was really upset. And yeah, I think you talked about, and you were empathic also when she talked about her family. And okay, so what are the bullet points that you wrote?
I write history and examinations and psychological support, antenatal care, intrapartum will do viral load and cesarean
Mhm,
section will do other virology, hepatitis C virus,
mhm,
and heart, no breastfeeding, postpartum contraception, and follow-up.
hmm. Yeah,
Uh,
whatever you write is good. You wrote multidisciplinary team care.
no, I didn't write it, but I
Also
say it.
in your
But I did.
point, so that you don't forget it. You said it. Like you mentioned the multidisciplinary team care, but it's very difficult to pass a station if you don't talk about multidisciplinary team care and follow up with the consultant. It's a kind of safety, you know.
Mm.
So always it should be in your bullet points. And then the support groups at the end and patient information leaflet is also important. So, and then you can talk about all of the investigations and this the medication that need to be done, and then she need multidisciplinary care, and you need to refer her to the internal medicine doctor so that he will start the medication and he'll do the rest of the blood test to see, and he'll do it successively, like 2 or 3 times, and then at 36 weeks. So,
Yes.
and then talk about what are the circumstances in which she can deliver vaginally and with precautions.
I forget this, but
This point,
on cesarean and breastfeeding.
yes, you said right about the prevention, like prevention for transfer, and it can go from 50 in 100 to less than 1 out of 100, which you mentioned that it can be less than 1 out of 100 if you will do all these precautions, which is good.
Better not say percent. I tell her like 1%. I should not
Yeah,
tell like this one.
yeah, with the patient. Now the RCOG people, even the RCPI people, they want you, while you are talking to the patient, they want you to use the late term, and they are really picky about these small details, that you are
Okay.
communicating with. It comes in communication to me, that how you
No.
communicate with the patient in her language so she can understand. So if you will
Okay.
say 1% out of 100, so this concept will be more clear to her instead of saying 1%. So she has to think at that
Okay.
time. Oh, 1% means 1 out of 100. Okay, because she's listening to you. She's not. So it's better to be very clear with her.
Okay.
Okay,
Okay.
what do you think that is it like much different from the RCPI or scheme?
It's not much different. It's not much different. I need to go back for practice and decrease timing of this history taking and revise this again.
Yeah. Yes. So
Yes.
and read all of your guidelines and the important talk articles, because we will do examiner stations. This is only, I just wanted to know that what is your like, if the stations that we were doing before still in your mind or not. But
You are a great teacher, Dr. Samira, really. Really, you are great.
no, that is very good that you still initially in the first station you forgot even how to introduce yourself. So I said, "Oh my God!" But then you are
2 years now. So I'm back to street again.
you are back from in the second one. You are back, so you
I will
can.
do my best, inshallah, with
Okay,
your guidance.
inshallah. So let me stop at least the recording here.